From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Wednesday, January 20th. I'm Lena Tillett. Before we get into the latest stories, we want to ask a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to fill out, and we'd really appreciate it if you could fill that out. You can find it at WRAL.com/coronapod. Again, that's WRAL.com/coronapod. Thanks so much. Now for the latest coronavirus headlines. The rollout for vaccinating more than 100,000 additional adults in Wake County hit a snag as soon as the phone lines opened Tuesday morning. The new system for Wake County's COVID vaccine hotline became overwhelmed from the minute the phone lines and website opened. However, 23,000 people were able to register on the first day. According to the website, it could be several weeks to months before they're contacted for an appointment due to the limited vaccine supply. In Durham, leaders hope to vaccinate at least 200 people a day at the county's new mass vaccination site at Southern High School. An appointment is required, and you can help in the state's effort to vaccinate North Carolinians. Joe Fisher tells us how.
Overwhelming demand for a COVID vaccine has shown a major weakness in moving people through the line.
We realized pretty quickly that there was really a ton of work on the back end that these agencies that are giving the vaccine need to do.
Now the state is recruiting volunteers through its training exercise response management system known as TERMS. In the first week, 200 people have signed up to help with tasks like data entry, parking, and answering phones.
Anyone can draw from the pool, whether they're a local health department or a hospital or some other location that's administering the vaccine. And we may see doctors' offices down the road doing that, and they may need some help with the process.
Cary Pediatric Center, like all doctors' offices, still doesn't know when they'll receive doses of the vaccine for its patients. In the meantime, Dr. Brian Bowman is encouraging his staff to volunteer at community clinics.
With the proper training and proper equipment, your risk isn't high in those sort of situations. There's plenty of folks like myself and other colleagues of mine who know that the higher vaccination rate we have in our community, the more we protect everyone.
The process of getting shots into arms now includes neighbors helping neighbors.
If you're interested in volunteering at a vaccine clinic, we've posted the website to apply over on WRAL.com or the WRAL News app. For the North Carolina Coronavirus Podcast News Brief, I'm Lena Tillett.